Over 84% of YouTube users like you watch health-related content online, then make decisions about their health based on what they saw. But we want to know, why do so many of us hesitate to go straight to our doctors with our questions instead? And when using social media to guide us, how can we know who and what to trust when there are so many content creators out there? So we thought, who better to ask than one of the most trusted doctors on YouTube, Dr. Jen Caudle. As a board-certified family physician with over 367,000 subscribers on YouTube and 190,000 on Instagram, she's covered a very wide range of health topics in her videos, from common questions.
There's this sort of thought that like your vagina like falls out of your body and like disappears.
That is a very common thought.
That's why I was like, ladies, your vagina don't go nowhere.
To more surprising and unexpected ones.
There's a big cancer myth that goes around and I debunk and people get mad at me. But this idea that if cancer is exposed to air, it's going to spread. Have you?
I have heard that.
Yeah.
It's quite interesting.
Let's jump into our interview with Dr. Caudle. I think you're going to love this one.
Dr. Jen Caudle, it is so good to have you here on the Hers podcast, also known to so many as Dr. Jen. How have you been?
I've been great. It's so good to see you again. We don't see each other enough.
I don't think we see each other enough. I think we see each other a lot on social media.
Yes.
In our DMs, we chat.
Actually, before we started the podcast, I was talking to someone saying, how did I meet Dr. Jessica? Where did we meet?
We met in Philly. Well, we met throughout colleagues in Philly where we both did training. I was there for OBGYN.
Did we meet on TV? Did we do a TV segment together though?
We did not.
Oh. Okay.
But I do think that in social media is kind of like what created our relationship. But we do know each other from years past. So it's good to have you now here.
Oh, thanks for having me. It's good to see you.
Absolutely. I love seeing you. I love seeing you on social media because that's where you thrive. That's where you thrive. And I love the ability that you have to connect with viewers.
Thank you.
But I wanted to learn more about behind the scenes. I think behind the scenes is what a lot of people want to understand, and how you got to where you are as a social media doctor. I think that could be kind of like one of your like subtitles.
I think that's
You're
fair.
like board certified family physician, also known as social media doctor.
That's fair. Okay, but before we go into the questions, I would be remiss if I didn't say, my dear Dr. Jessica, also, and I'll say this once and I'll let you do your job, but also social media, amazing star, TV star, amazing OBGYN. You can't tell this stuff to me without me saying it back to you.
I appreciate that.
No, come on, we're not going to do that.
Okay,
so,
all
right. So
now that we've both done that,
yes,
we can get to the heart of the matter.
Fair enough.
I have even had patients who have come to me and showed me your videos.
Oh, really?
Because of information that they've heard.
Which videos?
I mean, well, there's so many that I think that they always find something that is obscure. And that's what we were talking about as well. Some of the points that you bring up and the tips that you bring up are things that people think about, but maybe don't want to talk about.
They don't want to talk about. Yeah, that's so true.
They don't.
Yeah.
So it's how do you bring this up in a reputable way, but also with evidence behind it, right?
Yeah, yeah.
I think evidence is where we see as physicians that we lack that in social media. And so we want to bring that to the forefront. So you do such an excellent job at it.
Well, thank you.
Yeah, I love that you're able to do that.
Thank you.
I want to go back to, one, how we met, but also you posting online. Do you remember the first time that you posted online in a way that was content, in a way that showcased who you are and how you wanted to get that information out?
So I do, but that's not the story I'm going to tell you.
I want to hear it.
Because you know what? I was thinking you were going a different direction, but I'm going to tell you this other story anyway. The first time, so I didn't do my own content before the pandemic. I just posted my TV segments. You do a lot of TV. I just post clips from whatever show I was on. Right. That was my thing. And I remember it was a girlfriend of mine who, I was on Instagram, I was on social. I might have had 13,000 Facebook followers at the time or whatever. And she was like, you should make your own videos. And I remember thinking, why would anybody watch a video of me? Like, I felt like, and this is not going to sound great, but this is how, imposter syndrome or whatever, I felt like my value in terms of communicating medical information was being on someone's show. And it's not that it wasn't, but I just didn't think that anybody would listen to me other than that context. And it was during the pandemic. Okay, listen, this was right before the shutdown.
Yeah.
And luckily, I was at the hairdresser. I didn't know we were going to be shut down, but I got in right before the shutdown.
I'm sure you were very happy that happened.
After the fact, certainly I was. But I remember I was at the hair bowl getting my hair washed, and there was and COVID, we called it coronavirus, and it was going around, and people were starting to talk about it. And there was a lady next to me in the beauty shop. She's like, well, you know that coronavirus don't affect Black people. Black people can't get coronavirus.
Like, I'm doing a video.
I said, what? And I think I almost got whiplash, and I turned my head around, and I was like, oh, no. And literally, I went home that day with fresh hair, which was fabulous.
Which was perfectly timed.
Perfectly timed, right? It was the first time I did a direct-to-camera video. So this was 2020, right? I was doing multiple segments on CNN, Fox, whatever. But it was the first time I did a video, and it was on Can Black People... One of the early ones was on Can Black People Get Coronavirus? I did one on Can you still get packages from Amazon? I wanted to answer questions that people were asking at the time.
Right.
And they went viral into the millions. And I had no idea what this thing was. And that's really what started it. So I'm late to the game. I didn't start this till 2020.
But you had some credibility in the sense of what information you were sharing on media.
Sure.
And from that one interaction, and also from your friend, we'll give her props as well, is that you're like, I'm going to now take this initiative to bring to the screen in the form of questions and answers. How do I get the correct answer out there? But also, I think one of the things that you have done so well is how do I make it not only relatable, but something that someone wants to watch? Yeah. Right? I mean, you have to capture people's attention or they're just not going to listen.
That's true.
When you think this is really reaching people, you kind of had that fact early on if those went viral pretty early. And so since then, what have you been able to see? Because there's always kind of a magic to what you post and if it's going to go viral or if people are going to pay attention. What has worked for you?
I try to answer people's questions. You know how people always say, like, don't read the comments, don't read the comments. Nah, man, nah.
The
I'm
comments
all up in them.
Yeah.
Because you want to see, you know, like it was. So there's a video I have that is on YouTube that reached 10 million views. It's on what happens to your vagina if you don't have sex in a while.
Oh, yeah.
That video came from comments, and it was from people. I did another video about sex, and people said, well, what actually happens to your vagina? I realized there was this myth out there that if you don't have sex, and I'm not talking about postmenopause, like I'm not talking about the hormonal changes.
You're just like at any time.
Right. There's this sort of thought that like your vagina like falls out of your body and like disappears.
That is a very common thought, yes.
Right? And so that's why I was like, ladies, your vagina don't go nowhere.
Right.
It is still here, you know? So it comes, a lot of what I talk about comes from what people ask.
Yeah, and they are asking these questions.
They do.
And many times they're not asking in the formality of an exam room when they go to their doctor because they feel it's taboo, especially on the sex topic. So when you think about sex ed content specifically, is that something separate for you, or does it just kind of fall into the algorithm of the questions that you're answering?
Yeah, so I have to say it's a little intimidating because I'm literally talking to a world-renowned OBGYN. Right. I literally told your producers, they're like, let's talk about this. I was like, do you really want me to do this when I'm being interviewed by your GYN?
All of a sudden it becomes a showdown, right?
I mean, no, it's not.
Information.
It's like I defer to you, Dr.
And I'm like, well, I'm going to refer to your video. I'm like, let's bring a clip of her video and get that answered.
That's hilarious. But my perspective comes from being a family doctor. Yeah. I'm not a GYN like you. You are the expert in all things womanly stuff, right? And this is what you do in and out every day. It's not everything I do, but I get questions.
A good portion, right?
Yeah, I get teenagers. I get young adults. I need to screen them for STDs. I have people, I'll never forget, this is graphic, but welcome to my world. I remember years ago, I was a young attending, and I had a young girl who said she only had anal sex. She was literally very, very young, only having anal sex because she couldn't get pregnant that way. Not that there's anything wrong with anal sex, but this is my world, right?
Right.
And it's about education. It's about informing. It's about let's talk about this stuff, and the myths out there.
Oh, there's so many. I'm sure if we spent a good hour, we could probably maybe go through a quarter of the myths that we've heard as a physician from both aspects.
Yes.
I think, even as an OBGYN, I do hear very focal information, but you get really the broad scope of what people are really coming in with from their day-to-day life. But when you think of taboo topics, I mean, that could be with anything. What do you think seems to resonate the most?
So sex is a big one in terms of taboo.
Yeah.
There's myths about masturbation being evil or bad.
Yes.
There's myths about, if a woman, the more sex a woman has, her vagina will stretch out.
Yep.
There's tons of myths about sex and sexuality, which as I've done this and learned more, a lot of it's rooted in a lot of things: culture, religion, environment, how you're raised, what part of the country, what part of the world, so many things. But then there's also a lot of sort of taboo and myths about cancer. Right?
Yeah.
There's a big cancer myth that goes around, and I debunk, and people get mad at me because they know what they were taught, even though it's not entirely correct. But this idea that if cancer is exposed to air, the idea if you undergo a cancer, so I'm curious as an OBGYN if you've ever heard somebody say, I don't want a breast biopsy, I don't want a hysterectomy because if the cancer is exposed to air, it's going to spread. Have you?
I have heard that.
Yeah.
It's quite interesting when you hear these myths, especially because what we're usually bringing to their attention is a way to get either a diagnosis or a cure.
And to fix themselves, right?
So I wanted to show you this stat because I think you will find that this is very interesting about adults who watch health-related videos on social media. So that's the percentage. 59% of adults who watch health-related videos on social media.
Yeah.
Is that shocking to you?
It's not.
Did you think it would be higher or lower? You pretty...
So 59%, I definitely can believe it. I might have thought it was higher, but I definitely can believe it.
And then the other stat.
This is actually what surprises me the most.
Yes. So this is looking at YouTube users who make decisions based on what they watch. 84%.
That's a lot.
It is a lot.
Yeah.
So does that make you a little bit worried?
Yeah. Did you see me say that's a lot?
That's a lot. And why does it make you worried? I mean, I have my ideas on why that's worrying. But
so if I tell mine, will you tell yours? Because I want to know what you think. You want me to tell my first?
Yes, I want your opinion first.
So I worry about misinformation. I worry about misinformation and disinformation, right? Because the sources are not always vetted. And this is the thing. Especially with AI now. Did you know that they are making AI?
Yes, I actually had that done to me recently.
Did you? I did too.
Yes.
I wonder if we had the same video.
Well, it was something that people sent to me. And what happened is when I was on Mel Robbins, they took a clip from that and they change your voice and do a complete voiceover. And all of a sudden you're like, that is not me and that's not what I'm saying. But people sent it to me. So I wasn't aware of it until I saw it. And you've had that happen to you as well.
It happened to me. They took one of my videos and they zhuzhed up my mouth. They changed the mouth so it moved with the new script and basically had me saying all this BS about diabetes that is not true. I do not believe in and is not evidence-based and I would never say.
Yeah.
And
Isn't that interesting?
Yes.
That now they've used your likeness to deliver health information that is inaccurate.
And the thing is, if people didn't know me or didn't know you, to send it to us or to say, oh, that don't sound right, right? People could believe that.
Oh, a lot of people. I mean, imagine the access that people have to social media and what AI can do with that. So I think that's another feature that can be used for a good or bad purpose.
Right.
But I saw it obviously used in a bad way.
Right.
The information in the videos that you have out, and now knowing that potentially 84% of YouTube users are making their medical decisions
based on it,
on what they watch, is pretty interesting because I think we've had for decades the ability to see a healthcare provider and to have that interaction. So I wanted to question and seeing now that you do see patients, in your practice.
Always have.
And now that you provide information on YouTube, is why do you think there is this change between people who see you in the office and you're giving them sound information, recommendations based on evidence-based medicine? That same person may go watch a YouTube video, make a completely different decision based on what they see.
Yeah, it tends to be scary. It also is the reason why, on a separate note, I think all of us physicians in healthcare, well, I should say physicians in particular, that's what I am, so I can only speak to that. It's why we physicians actually need to be on social media. I hate to say it. I wish I didn't. I wish I didn't have to. But the truth of the matter is, it's almost feels like it's not enough being in the office anymore, which is speaking to what your question really is. Yeah. Why are 59% watching health-related videos? Why are 84% making decisions? People want information. And I think sometimes social media is easier. Easier meaning more accessible. If you don't have health insurance, if you have a problem seeing a doctor, there's social media. Also, you can ask questions perhaps or get answers to things that you may not feel comfortable bringing up to your doctor or don't feel like you have a doctor that you trust. I would also say on the other side, we are doctors and we believe in what we do. We give evidence-based medicine and, we are proud of what we do. But the truth of the matter is there's a lot of bias in medicine, which is a whole nother video I got. Yeah. We doctors, healthcare providers, statistically often, or too often, I should say, judge our patients based on their weight, their religion, their sexual identification, et cetera. And there's a lot of people who don't want to be going up to no doctor's office.
Right.
Do you know how many people tell me they hate being weighed? Like the scale alone, is enough to when I ask this question, I have to figure out what video I want to do about it. But I never understood how.
I would agree with you. I never understood because I just felt that it's a part of health information. Yes. But people really do have a personal.
Yes.
There is a fear behind it, and so I had to actually have a few patients disclose that to me, and then for me to ask the question of why. Why wouldn't you want your health information? And they said that they felt a little shamed. Some of them felt that maybe the person who was taking them through that process might have an opinion about them. And so because I never really saw that from their perspective, and I never really thought to ask from their perspective why they felt that way, that I felt I needed to be more curious as a provider in asking these questions on what a patient feels and why.
Yeah, and why.
So I think that, we have to do a better job as healthcare providers to ask our patients, how does that make you feel?
Right.
Or what would you prefer?
Yeah, is there something better?
So they're not uncomfortable. Right. I think discomfort has a lot to do with you sharing the truth and being honest about your health information.
Not feeling judged. Feel judged by their doctor or in the healthcare system.
Yeah. So we have an obligation or a responsibility, obviously, to change that dynamic between the interaction of patients and their healthcare providers. So I love that you have the ability to see patients in person, but now the amount of work that you do on social media actually allows you to actually see that dynamic between both. Yes. And so then I'm going to allow you to tell all the doctors to be on social media. I'll leave that to you. I'll make that your job.
Fair enough.
I find that the information that we have clinically and behind studies and why we do the crazy things that we do as physicians, a lot of patients don't understand. Yeah. So going back to the weight, right? We have patients who come in and they feel, I don't want to talk about my weight. I don't want to see it. I don't want anyone else to know. But we know why we collect that type of data for patients as they come in. Right. What would you say if a patient, or if you're making content, why we use weight for health conditions or for patient information?
It's actually very important as a metric. As a family doctor, some of the most important times that I use weight, just saw a patient in the last couple of weeks. She was concerned she's losing weight and not trying to lose weight. And we certainly always get worried about unintentional weight loss. Yeah. We worry about cancer. And when I have weights that I can look at over time, and I can look at 6 months, a year, and say, okay, wow, and calculate the percentage, wow, your weight is down this percentage or blah, blah, blah. That's objective data that's very, very helpful to me. Or if someone feels like they're losing or gaining, and I'm able to say, actually, no, look, actually, when I saw you last time, it was the da-da-da-da-da. Because there are some people who don't weigh themselves at home. Yeah. I have patients who don't weigh themselves. So their only weight that they get is when they come to the office and they'll say, oh my God, I've gained so much weight. I'm like, girl, you're the same as you were last time. They're like, oh my God. But also on another front, there's things like edema, swelling, ascites, a peripheral edema, congestive heart failure. Somebody comes in with swelling. I'm able to put them on the scale and understand, wow, your weight is up 7 pounds, and it gives me an assessment. These are just a couple examples. But weight is and tends to be a very important metric. What I will say to that is that, and I've given this suggestion, I have a video on my YouTube channel about what to do if you don't want to be weighed at the doctor's office. Because it still is your health.
I think that's the most important part of it is we know we need it clinically, even in women's health. I think especially in midlife for women, that one that you were saying, I feel different, but you weigh the same, often happens because of the shift in maybe loss of muscle mass, so increase in fat mass. So you may kind of stay in that plus 5 or 10 pounds, which not everyone wants to see that change, but it's not significant that you would see maybe with a health condition that might be cardiovascular, like CHF, congestive heart failure, or cancer. I have had patients who, when we looked at them just physically, I'm like, you look like you may have lost a lot of weight. Let me let me look at your weight that you were the year before and the year before. And then you do see those dramatic changes in weight, which alludes to, let me now order imaging.
Yes.
Let me now get some labs, which may help me understand why there is this either weight gain or weight loss. So weight is very important to helping understand, even in pregnancy. Pregnancy is another reason why weight is important. Yes. So of course, for a woman who's going through pregnancy and they're like, I'm only getting heavier. So they don't necessarily want their weight taken. But we actually use that information to see, is there a correlation between what you should be doing in each trimester? So it is important to metrics, and obviously for your trimester, what is your weight gain?
Right.
And is there weight loss? Because at certain points in your pregnancy, you should be going, with weight gain. But then there's some times where people lose weight and that becomes concerning to us. So overall weight is important, but I do think that we need to do a better job at, like you said in your video, how are we collecting that data? And if someone feels uncomfortable, we find another way to get that data, right? Whether it's we put them in a room and they get their weight and write it down for us.
Right. Or a blind weight as something that people can do where
we do that often.
The person takes the weight but doesn't tell you what the weight is. Another thing I think is really important for us doctors is not having the scale in the daggone hallway. When I go to my GYN's office, I love y'all, but
why is this in the hallway?
We really got to do this here?
Everybody look at your weight.
And they say, okay, 189. Thank you. You can step. I'm like, oh.
Well, now everybody knows, right?
Right. And that's not good.
At that point, we should just put it on like a post-it note and just put it on your t-shirt and you walk back out into the waiting room.
Right. Yeah.
When you think about the platforms like YouTube and Instagram and Facebook, do you find that the people who come to watch you have more of an idea that they want sensational content? I'm sure you think about this when you're making content rather than medical accurate content.
I think there's different buckets of people. I get different buckets of people, and I love data, so I mine the data with my analytics pretty closely.
What do your analytics show?
Yeah, so I tend to weigh heavier with women than men. My age group is what I call the diabetes, hypertension, hyperlipidemia crowd. I'm going to say 40s to 65, 70s. That's my main audience. But then what people watch is in some buckets. There is the people who come for general information like, oh, what's an hemoglobin A1C? Right. Oh, what does that measure? Like, that stuff. There are some people who come for sensational content, like I do reaction videos to pimple popping and stuff like that, or TV shows. There are people who come for questions to be answered that they're not comfortable asking other people because they know I will talk about sex and masturbation and this and that. Then there's also another bucket of stuff that I do, which is I actually just shot a video right before we just shot this about a celebrity who talked about a gout flare that he had. So I do celebrity reaction stuff because people know celebrities. And when they share health information, it gives the rest of us the opportunity to learn from them. So people come for different things. I think the other the big thing is I'll do a lot of myth busting, and I get a lot of hate mail for this. Folks,
it's so interesting, but why are they upset?
They can't stand it. And so let me give you an example. Parasite cleanses.
Yeah.
There's a big thing about parasite cleanses. People are buying them online and they're convinced that they need them. And I was reading as I came over to the studio today, reading my comments, and somebody wrote on my YouTube, of course she doesn't like parasite cleanses. She's an indoctrinated doctor who doesn't,
Right.
And I've called all these names and this and that. So sometimes people come to reinforce views or beliefs they already have. And then they get mad or upset when those views may not be reinforced.
So they're not there to have their minds changed, obviously.
Some people I don't think are.
Right. Yeah.
And I found that during COVID, I got death threats during COVID because of some of the videos.
That is so interesting.
Yeah.
Is that because you were bringing the evidence
Because I was just saying what the facts were at the time. And facts change, not all of them.
Well, I think the pandemic was a very sensationalized time frame, and where we did, even from a medical perspective, we didn't have all the data.
We didn't.
We didn't know what this virus was doing. And so there was a lot of opportunity for people to come up with their own claim.
Right? And we've never had a time like that in our lifetime that I remember. I remember doing a CNN segment on, this is literally, it was right before the lockdown. This is when everybody was buying up masks on Amazon, and we needed them for healthcare workers. We needed the N95s. And so the guidance from the CDC and all the healthcare, Fauci and all the people in charge at the time was stop buying masks. That was the official guidance.
Right.
I go on CNN and say that. And literally 2 weeks later, another network is using me in a montage of videos saying, see how wrong they were. They're just deceiving us, blah, blah, blah. what was hard for me was sometimes this kept me up at night. You do a lot of TV, so I don't know if you want to weigh in on this. I'd be curious as a colleague in this space. It was often very emotionally tough on me. I lost sleep. I shed some tears over giving guidance that wasn't wrong at the time that I gave it. It was the guidance. It was the best evidence we had. The problem was 2 weeks later, it changed. I remember almost losing my mind because I've never lived in a time where medical information has changed like that.
We have never really seen that in current history.
We don't.
We did not. And I do remember making a lot of videos very early on Instagram on whether it was airborne, whether it was on countertops. And I think that is really where I started to see the shift in, as best as we could, give evidence, what we were able to give at that time. It was changing almost daily. So now that we have seen how information can work for you or against you, when you think of the social media platforms that you're on, do you think that they curate content for individual users that can work with or for good health information?
I think it can go either way. You know, I think one of the big things with social media platforms is we think about the likes, the clicks, the comments, the engagement. And I'm no engagement expert, but the word on the street is that the more engagement, shares, likes, the
Which
better
is
the
true.
video. Right.
It is true. But what I also think on the viewer side is, we kind of alluded to this before, is they're going to believe what they want to believe. So curiosity really is going to put them maybe on another path. But usually when someone has a kind of idea of what they believe, they may start to only view information that feeds that. And so the platform then gives them that information to them, rather than the opposite. I mean, you can see that in any forum. You can see that in health, politics.
What's
you
it
can
called?
see that in
Confirmation bias?
beauty.
Is that confirmation bias?
Absolutely.
Yeah.
And so I think that there has been a pushback towards the social media platforms of how does a viewer get their information, or what's being fed to them has a lot to do with, in the end, what they believe, right?
I'm so glad you said that, because that's such a better answer to that question than anything I was going to come up with. You're exactly right. And I totally agree.
So that's why we still do need the interface of people seeing their healthcare provider, getting individualized and personalized information, because there's a lot out there that even when you're sharing on a particular topic, that might be exactly the correct information, but is it the correct information for that individual watching?
That's right.
You know, someone could watch you on a specific topic on hypertension, and they may be taking their medications, but then their diet is crap. Right. So they still, that information may not be valid for them at that time in their journey of hypertension. So that's why we will never not need providers.
So true.
But I think social media brings out a sense of, I never knew that. Or let me investigate more. Or what does that really mean? And when I think of providers and kind of the position they hold, both on social media, which I agree with you that we do need more, because the demand is there. The demand for information is there, but who's giving the information is the other part of that.
Yes.
And so we do need accurate, evidence-based information on social media. But we also can think of how we can see information being discriminatory rather. And you talked about that earlier as far as bias, but you talk a lot about medical gaslighting on your videos.
I do.
What started you talking about that? And what does it really mean for you to be able to bring that to the platform?
Yeah, so that's important to me. So medical gaslighting, for lack of better way to say it, is simply the idea that you have a complaint or an issue, and your issues or complaints are dismissed by your medical provider. They're minimized, they're dismissed completely, they're not addressed appropriately, they're not worked up. And that can happen for a number of different reasons. A common example, I actually had a patient write me on social media saying that she'd gone to a doctor for some sort of joint pain, had gone back a number of times, and the doctor really didn't do anything, said, oh, well, if you lose some weight, things should get better. It just kind of patted her on the back and sent her on the way. Turns out she actually had bone cancer.
Yeah.
And she found that out from pursuing her symptoms. And, when things are sort of brushed on the rug. But anyway, but sometimes these things happen because as healthcare providers, as I mentioned before, we often we can carry biases just like the world we live in, right?
Right.
And there can be discrimination. Oh, if only you just lost some weight. Well, oh, you're just a little anxious, or if, oh, you just need a little bit more sleep, or whatever. Look, I'm not hysterical, and my weight's not causing this problem, or rather, my weight's not a reason why you shouldn't take my problem seriously.
Absolutely.
So my point being, to answer your question now, is I bring this up because I feel like I know what it feels like to feel some kind of way at the doctor's office.
Tell me more.
And I talk about everything.
You do. You're a very open book, and I love it.
Dr. Jessica's like, yes, you talk about it a lot.
I love it.
I don't know. Sometimes my parents are like, hey, Jen, we saw that video. Right. So this is the thing. There have been times I've been discounted, but what I remember even more so is when I was a child, I grew up in Iowa. There are some Black people in Iowa. Yes. And it was a great place to grow up. But I remember we used to get dressed up to go to the doctor. Talking church clothes almost. Hair was done, teeth were brushed, Vaseline shined up.
Ooh, your face was done too.
You were just ready to go. And it was a sense of wanting to put your best foot forward in
order to be believed.
I believe that is the undercurrent. My parents never said to me, hey, we're going to look nice for the doctor so that they'll believe us, but we're Black.
Yeah.
And it was a time. It's still a time, but let's be clear about that. And there is a sense that perhaps if we looked as good as we could, and we acted and behaved as well as we should, and perhaps we'll be treated well equally, and we'll be given the time and respect we deserve. And there's sort of a subconscious sort of, even to this day.
Yeah.
I'm a doctor myself. First of all, I get nervous going to the doctor. Not only that, I get dressed up. Hair done. Sometimes I put my lashes on. Sometimes they're already on. But I'll go to the doctor.
So
I get nervous. I worry that my doctor's going to think something about me.
Yeah.
I'm sitting up straight. I'm like, okay, well, yes, no. You think I was, I wasn't a doctor myself. Right. I get anxious about it because I worry. And this is a common belief or a common feeling. A lot of people worry. And I've asked them about this too. They worry about doctors and healthcare providers taking them seriously. Their complaints being heard.
There have been many studies that have kind of showcased and proven that, one, medical gaslighting does exist, and that there are certain communities, and you named them before, it could be based on religious, sexual, ethnicity, that they are treated a certain way. So I wanted to show you a stat specifically on discrimination in the healthcare system.
Yes, let's see.
So when we talk about discrimination in healthcare system, this is how many people experience discrimination in the healthcare system.
Yeah. Oh, wow. Yeah. 21% experience discrimination in the healthcare system, but 72% experience discrimination
more than once. So that 72% is of the 21% that experience discrimination.
Okay, thank you for clarifying.
But what I would say is this statistic is actually shocking for me because I thought it would actually be much higher.
I would have thought it would have been much higher too.
Yeah. I think I've heard in my practice alone, and just in the almost 20 years of practicing, that I've probably heard more instances of medical gaslighting, especially in women's healthcare.
Absolutely. Well, you described the situation with the scale. One example, you said someone told you that they were worried about what the nurse would think. Yeah. It's maybe not medical gaslighting, but it's this fear of being judged, this fear of being persecuted or being treated differently, or someone simply having an unfair opinion about you because of a number on a scale.
And I think that actually has to do, not to throw medical training under the bus, but I think how we were trained, being an OBGYN focusing on women's healthcare, I have seen that categorically in my practice, especially when it comes to things like pelvic pain, right?
And or endometriosis, perhaps.
Absolutely, fibroids, or just, painful periods alone when they go to the emergency room, not being given the appropriate attention, care, or pain medication. Right. And so this is something that has to be navigated in a different way because now we have the evidence, right? Yeah. We know from that study alone, and there's many more that show that medical gaslighting is a thing. So because I think we can agree here that the statistic is rather low, do you think that when we talk about medical gaslighting, that actually brings in the perspective of why patients may not go see healthcare providers?
Yes, and I do think this is low. I agree with you. I think we also have to remember with this that I think there's probably some people who just don't go to the doctor because of their concerns about being weighed, about being judged because of their sexuality or their color, their race, religion, et cetera. So, again, I don't know off the top of my head all the demographics within this, but yeah, I think there are some people who actually avoid healthcare altogether, who go long periods of time without seeking medical care or avoid it at all costs, like literally, or will only go when they can't do anything else because of this.
Well, typically, what do we see in disease progression, specifically cancer, when patients show up? Typically, they'll show up in a later stage because they were so fearful or they were like, I have heard from previous family members this is going to happen, which has some validity to it, because when you look at the history of medical care in America, there has been a lot of discrimination.
Absolutely.
So they're only hearing from people who have experienced it.
Right.
So even though there have been changes in the healthcare system or society and how we operate, they still have that weight. That's an emotional kind of trauma that they are carrying now to say, for myself alone, one, I may feel not great or I may have a symptom, but I'm not now going to go get the care because of the experience of someone very near and dear to me or have a bad outcome.
Right.
So I think that we do have, I think social media actually is one of the places that you can dispel a lot of those myths, which you do by busting myths, but also bringing in the emotional aspect of stories that they've heard and how we may have progressed and or changed. Even though there's a lot of work to do, we still have made progression in that sense.
Yeah, that's a really good point.
Yeah, I really do believe that we both have responsibilities. I think that the community has responsibility to be more curious, to advocate for themselves, because that really is self-advocacy, where you're like, even though this may have happened to someone in my past or close to me or in my family, I know I need to go to the doctor. And I really should go.
And on that note, I don't know if we're moving on to a different topic, but I do want to say, and the self-advocacy and the empowerment is so important. I've said this to patients, and perhaps you have as well, and to people that I know. If you don't like your doctor, fire them.
Yeah.
And you know what? You don't even have to explain. It's kind of like a hairdresser. Look, do you go up and say, well, thank you so much for you? Sometimes you just make an exit because that's the best way to go. And same thing with your doctor. You don't have to make an explanation. You don't have to justify your decision. You can call the front desk, get your records. You don't even have to talk to the doctor.
Right. You don't even have to let me know. I've actually told that to a patient.
Yes.
We were not, getting kind of that connection.
Yes.
She was combative in a sense, not combative to me, but combative in the way where she was like, I don't really believe what you're saying.
Yes.
And I said to her with the most care and authenticity, I was like, I want you to find someone who can answer these same questions. And I go, but what I will do is make sure that I'm still here for you if you need and you want to come back.
I love that.
And she did come back.
I love that.
And I said, this is an open forum where in the end, because it was a surgical consult, right? I said, in the end, I want, when you're wheeling down in that stretcher to the OR, that you've made the best choice for yourself. Not because I told you to do it, but you made the best choice for yourself. And so I said, I want you to go get a second, even a third opinion.
Yes.
And if you want to go with those other opinions, great, because you ultimately are the dictator of your care and your health.
Your health. Absolutely.
Right? And she came back and she was like, I have never had anyone tell me that. And I was like, I want you to be empowered in your health decision.
I love that.
And then we fell in love. So there's that.
Find you a doctor like Dr.
Right?
Jessica.
I was like,
and
why not?
I love how you brought up the second and third opinions, because I have a video on this. A lot of people are afraid that we will get angry or upset if they go get a second or third opinion.
But I will say there are healthcare providers who do.
And I say, if you have a healthcare provider who does get upset, you better run.
Yes.
Okay, you better run away from them.
Yes.
We should not be upset.
Absolutely.
This is not personal.
No, it's not.
We want the best for you.
Yeah.
And it is not who wins. This is not a winning.
This is not a competition. We don't get a medal.
No.
You do not get a medal. The person who should get the medal is the patient.
Right?
Because they made the best choice for themselves.
That is right.
I wanted to ask you some really quick questions because I think you are, to me, in my opinion, have killed social media, and you do a fabulous job at bringing those taboo questions to the forefront so people can watch it in privacy. They can be like, I always wanted to know the answer to this question. Let me watch this alone. But you are bringing these questions because now they actually know the answer. they're getting it from a credible source. And then they can also go take the answer, now go to their doctor and being like, you know what, I found out this information and now I really do need to take care of it. So bravo to you.
Oh, thanks.
But I wanted to know, why do you think so many women, especially women of color, feel ignored in healthcare settings? We touched on it a little bit, but what is your quick answer to that?
Quick answer, things we talked about, whether it's
Bias.
race, gender, gender bias, race bias, also historically. We haven't been treated right. Let's
start there.
We ain't been treated right.
Right.
Okay, so
and
let's
still,
just start
up
there.
until today, you can definitely see those.
Well, look at the racial disparities with the Black infant mortality rate.
Yeah.
And then let me just confirm this with you, because you are the GYN, but my understanding, correct me if I'm wrong, is that even when class, socioeconomics, income, et cetera, salary is controlled for, Black women still do worse. Am I correct? Yeah.
I think the best case scenario with that is Serena Williams.
Yes.
She even knew her past diagnosis, how it's increased in pregnancy, and was still declined the testing that would be necessary.
Oh, it gives me the chill. Like, literally, it just gives me the chills.
Doesn't it? So now you have someone who...
This is why I dress up to go to the doctor.
All the metrics.
This is why I dress up to go to the doctor.
Right. I don't want you to have to dress up anymore. I want you to go in pajamas next time. I don't know if I'm going to...
I don't know if I can do that.
We talked about hygiene, as you have in your videos, and bathing seem to be like super popular topics. Why do you think that is?
And look, they are popular with me. I care a lot about that, because as a family doctor, I see, and look, I'm not talking about when you're not doing, when we're sick, we're not at our best. That's not what I'm talking about. But I look in a lot of ears. And by the way, earwax is protective. Earwax is not a bad thing to have. If it's coming out of your ear, I want you to kind of tend to it and kind of get a towel, wipe it away. Sometimes earwax can cause a problem, things like that, but it's not dirty or bad. But I look in a lot of things: mouths, ears,
belly buttons.
Belly buttons. I palpate your belly. I do pap smears. I look in vaginas. I look in a lot of stuff. And so these things do come up. But hygiene, from a medical standpoint, yes, I should say also that I've learned in doing these videos, because I know how I was raised. I was raised to use a washcloth. I was raised to get a rag and some soap and get all up in there. But everybody is different. And I feel that hygiene is cultural. It's religious. It's if you were born in the Caribbean, you might be bathing 5 times a day, where someone who is in a cold climate might be doing it every other day, right? So it's based on geography. There's a lot of things that go into how there is context behind it. But from a medical standpoint, we also know that hygiene sometimes can be behind infection. Not always, but there are real reasons to want to wash your hands, get under the nails, right? Wash between your toes, look at your feet, there are real medical reasons to do this.
I loved watching your video about how to shower.
Yeah. But you know what? I have parents coming to me saying that they gave the video to their child. So
that they didn't have to do it. See, you were doing...
I don't know that I'm going to trust that it's not that they felt like they didn't have to do it.
I think that maybe you were a better source and you were doing God's work. Look at you. I love that. Do you think that social media helps people find the words to express things that they don't feel empowered to express?
Sometimes, yes.
I think yes all the way. Because you're giving them the language, you're giving them the authority, but also the evidence behind it, a reason why. So people may think things in their head and have a thought or a belief, but a lot of times you're able to either bust the myth or validate what they thought. So I love that. Thank you for doing that. Have you seen social media conversations about weight management shift over the years? I mean, I know the answer to this, but what are your thoughts on that? And how is that both in a good way and possibly not such a great way?
Can I just change that question a little bit? Because I need to say something about GLP-1s.
Yes.
That's what I need to talk about right now in this moment.
Say it.
First of all, these medications, just like any, as you know, are not indicated or right for everyone. Nobody said they were. Second of all, half of them are for diabetes, about the other half are for weight management. Third of all, can we please stop shaming people for getting healthy?
Oh, well,
shame.
This is where this all is rooted, is people want people not to be healthy.
And I can't stand that. We criticize people for being overweight.
Right.
We say, you're not working hard enough. If only you ate healthier. If you just fixed your diet. We shame people. We criticize people. Now we have tools, and you know what's happening? Yeah. People are shaming and criticizing people.
You can't win either way.
But you know what? Whenever I write a GLP-1 in the office, and I write them frequently for patients who qualify, I will tell them, I said, now listen, these medications oftentimes help with cardiac issues and so many other things.
We have so much data behind.
We do. And I have to tell people and give them the speech, I don't want you to hear the shame noise. I had one patient tell me, she says, Dr. Caudle, I can't tell my aunt and my mother I'm on this. And that's where we're at. And I need that to stop.
Yeah. It absolutely needs to stop. And I think the way we're going to get there is, one, with evidence, right? The evidence clearly shows in the ways where it's helpful, but also if you talk to the patients who are on this and how they feel about themselves as they've become able to do something that for so long they were unable to do.
Can we just brief note about why people can't? Because we used to shame people, even doctors who would shame people. You're just not trying hard enough.
Yes.
We now know that obesity is environmental, it's genetic. There are some people, and I say this to my patients, I have patients that weigh 87 pounds soaking wet and they eat everything they see and they'll never weigh differently. I have some patients that are 350 pounds and they always have been, no matter what they do. And we have learned that it's not just about willpower, which is why these tools are so important and also why the shame needs to go.
Yeah, that will take time. I do see that the more we talk about it. So what we found
I love
historically.
how composed you are. You are amazing. I'm over here waving. I'm like, and you're like, yes, we do. I love this. I need to be more like you.
Because I want to be more uncomfortable. I want to have more uncomfortable conversations like this because the more uncomfortable they are, eventually they'll be comfortable.
Yeah.
And then we can all just get along.
Yeah.
But, that's maybe a long time from now, but I need you there with that fervor that you have, because that really is, one, what helps in social media. They want to see the emotion behind it. And I love that you have that all.
Well, I need a little bit more of your composure. That's what I need. That's what I need to channel and manifest.
We both need to channel each other, right? Okay. So I want to now talk about patients when they come to see. I'm going to use the juxtaposition of you seeing patients in the office and you being the social media doctor, right? Giving all that advice.
Sure.
Now that they have seen your videos, right? Now that they have understood the evidence behind it, how would you tell them to go now navigate their health from that point?
Yes. Anything that you see online that you are interested in exploring, make sure you take it to your doctor. I had a patient last week literally bring in a TikTok video that she saw, and actually I liked it and agreed with the plan of action. I was like, girl, yes.
You're like, co-sign.
Yeah, I did. I absolutely did. Look, we want our patients to be educated and informed. I know you are the same way. It's not that I don't care where people get information. I do.
Yeah.
But it doesn't have to be from me. I mean, look.
Right.
If someone else has a good idea and it works for you from an evidence-based standpoint.
That's true collaboration, actually, if you think about it.
Why not? And that's what we do every day, right? Yeah. So, but if you see something you want to try, a supplement, a vitamin, a test, a procedure, a this or that, run it by your doctor. The other thing I would say is start, though, with curating the people you listen to. And it doesn't have to be me, okay? They should listen to you. They should listen to board-certified physicians. There is a way to check board certification online. Yeah. Make sure your doctor, don't look at the phrase or the prefix doctor and assume they are a medical doctor.
I've definitely told that to my patients.
A lot of people are doctors, but they may not be doctors of medicine.
Yeah.
And thus, if someone who's not a doctor of medicine is giving you medical advice, I'm not taking my car to someone who's not a mechanic to fix it.
No, I wouldn't do that either.
Right. So let's not do that on the other side.
The other thing is, why would you do that with your health?
Your
health is actually one of the best indicators of longevity and the most valuable thing that you have. So why would you jeopardize that?
Why would you do it?
Clearly, you can see that I love statistics, but this one is based on health-related YouTube videos that are unbiased. What are your thoughts on that? 32%.
Yeah, that's not good.
Yeah.
That's not good at all.
Isn't that interesting?
Scary.
I mean, I'm not completely shocked by it, but
it's lower than I would have hoped. Well, both of us would have hoped.
Yeah.
Yes.
Yeah. So of all the videos that are health related on YouTube are unbiased. So I think there's a lot of work to do. You said it before that more physicians and healthcare providers need to be on social media. It's similar to, demand. There is demand for information, and so we have to be able to provide that. So in all this work that you've done since the pandemic on bringing up these topics, how do you inspire other healthcare providers? I know a lot come to you and ask you, how do you do what you do, or how did you get into it? What would you encourage them to do, or find motivation for them to continue to? A lot of people start and then they don't continue. What would you say is a good way to inspire them?
That's actually a really good question. How do we keep doing it? Because it's really busy. You're incredibly busy. I love your videos, by the way, and I want to see as much of your content as I possibly can. But you're right, physicians are busy. I would say I think it really helps to find the thing that always kind of makes you want to talk about, like, stuff that you have to drag your feet or be like, oh, let me do it. Then don't do that stuff. Yeah. If there's if you have a niche, if you have a certain thing, even within it, like I'm family medicine, look how many clean hygiene videos there are.
I know.
I'll be like, today we're talking about.
Did you ever think that would be what you would be sharing your videos on?
No.
Would be hygiene.
Do you know what it started with?
What?
Was some years ago, there was a poll or something where there was a certain number of people who didn't wash their legs, and it made news.
I saw that, and you got a lot of hits from that. You got a lot of segments from that.
I didn't post it, but somebody else did, and I was like,
is that how that happened?
I didn't start that. No, but I was like, let's talk about it.
I didn't realize that why were they missing their legs is key here.
Well, it's a good question. I think sometimes people wash up here, do this, and they let the soap run down. But once again, I was raised with a wash rag.
Right. So was I.
You gotta scrub, lift the stuff up.
So when the water washes down, it's gonna pass the bottom part and clean it. Is this what we're suspecting?
I love how composed you. See, this is why you hosted the podcast and not me over here.
I'm so curious. I'm like, tell me more.
No, I mean, look. I do think there are multiple ways to wash.
Right.
I'm not here to badmouth or whatever or shame anyone. I do think it's important to wash diligently.
Absolutely.
Can we talk about the belly button?
Let's talk about it.
Okay, because I did ask you this before we got started. Because I had this thing about belly buttons because they get gross and they get, but you know more than anyone.
Oh, I do as a surgeon.
Tell us.
And I get to see very closely belly buttons all the time.
You have to clean, somebody has to clean them out, right? Because it can be.
Yes, and the OR has to be completely sterile. And a lot of times that is an area that is not watched a lot.
You're still so diplomatic.
Watched or washed. So we have to clean them out. So what I have found is that I will tell patients after. I started telling patients after because now,
you
for two reasons.
Before. Wash your belly button before you come.
That is on the pre-op instructions.
Okay.
They missed that step. And so I helped them out with that step. But I never used to tell them because I was like, it's part of my job to do that so I can have a clean surgical field. But I started telling patients.
What do they say?
They were like, no. Was it? And I'm like, it was. So it's like this great, I think it's like this great point in a relationship where we're like, we're going there. Yeah. I'm going to have to tell you about your belly button. But they actually take it and they're like, you know what? Thanks. Thanks for letting me know. But they are shocked at first. I'm like, are we shocked?
Yeah.
Yeah. But it's a nice moment where you get to share something funny with a patient. I think that always kind of breaks the ice.
Sure.
And so then they get a little tip.
They can get infected though too. Once again, we talk about hygiene as physicians. We talk about it though because cleanliness sometimes can play a role.
It can precipitate a disease process. It can lead to something. It can mask something as well. And so I think that's important to understand that. So thank you for that little hygiene tip. I think that sex advice, we started out with this.
Yes.
Sex advice content. As an OBGYN, I think you felt that I would have more information on the sex topic.
Yeah, I'm completely intimidated by talking about this with you. I have such imposter syndrome right now.
No, don't, because guess what?
I told your producer, I said, why are you asking me? She's a GYN, ask her.
I feel that when they come to me, they feel a little bit more hesitant to ask me about it. So I feel I'm always asking for patients to tell me about questions or concerns they may have about sex, intimacy, issues with sex. Yeah. And then it will come out. But I do feel that you might now get a lot more questions your way because of the content that you make.
Yeah. I want to normalize it, like vaginal dryness. Like that was a topic I never understood. I never knew how pervasive it was. I know you know, but I don't see people for vaginal dryness. If it comes up, it's a by the way. But it wasn't until these videos that I was like, oh my gosh. So yeah.
I brought a special guest for you on the podcast today. Yes, I did. So as a gynecologist, look, I had to. Why wouldn't I bring a vagina and a uterus and ovaries? So you actually get to have this special guest. And I want to know, do you have a model like this in your office?
No.
So I'm going to gift you with a uterus and ovaries. And
I'm going to use it in my next video.
You talk about vaginas all day long. Yeah. And so now you get to show a model of the vagina.
That's so kind of you, actually. This is
Did you
really
ever
nice.
think that here today you would be having your own model of the vagina?
I really didn't. But I actually do really
What kind of
appreciate
gynecologist would I be if I didn't gift you with a vagina?
What kind of gynecologist would you be if you didn't have multiple vaginas just available to
I
give?
see lots of them, and so I thought that I would gift you with.
Oh, it's so sweet of you.
Because when you're talking about something that's uncomfortable, sometimes that is the icebreaker.
Yeah, it is
to bring
helpful.
something
Bring a
out,
picture.
a lot of times people do not understand their anatomy.
Do you bring this out with every patient on many of your patients? Yeah.
Well, I even have one step further. I do have one of those, and I have a vagina puppet.
Explain, please.
Yeah. So vagina puppet, they are the most fascinating puppets. And I can, like a puppet, you can put your hand in there so you can show
the
them.
Vagina?
Yeah. But it's a puppet. So it's like fluffy like a puppet.
Okay.
And it looks like just like a vagina. And you can show them the different parts of the vagina. I love this look on your face right now. Yeah. And I will be sending one. I will be sending one to your office.
Oh my God.
And so when the front office opens it and they're like, Dr. Jen, what is this? You're like, it's a vagina puppet.
Wait a minute. Watch me do a video courtesy of Dr. Jessica. We now have.
Now I'm definitely sending you a vagina puppet.
Oh my gosh.
Now that we're talking about vaginas and uteri and ovaries, what's one myth that you would like to bust for women in midlife or perimenopause?
And you do such a great job of talking about menopause, perimenopause, and bone strength and everything. So hats off. I think the most important thing that I see where I'm at as a family doctor is I don't ever want people to feel like they have to settle for the symptoms that they have or sort of deal with it.
That is probably the number one thing that I say as well.
Oh,
I say, why are we living like this?
right.
Yeah, we don't have to live like this.
I don't want women to live with whatever it is. And as a family doctor, I don't prescribe estrogen. I don't prescribe hormone therapy. That's not what I do. You do that. But I don't want people living with this stuff. I want you as a woman to seek things out.
Well, that's why I love collaborating with family physicians, is because people will come to you for everything under the sun. The best part about that is that you can then send them to the person who can help them best in whatever facet that is. So send all your patients who are in midlife.
A board certified OBGYN, it's really important. It's especially in this day and age of, and at some point, I really want to hear your take. We can talk about it offline on menopause, perimenopause, and all of this stuff out there.
I think that's why they don't know necessarily to come to the OBGYN in midlife for a symptom that doesn't seem to be related to their pelvis.
Oh, interesting.
Right? So say, some obscure symptom of perimenopause could be itchy skin or ringing in the ears.
Yeah.
Right? So they're like, that has nothing to do with what I'm going through or perimenopause, but it actually is. So that's why I feel you and your videos and being the family physician that you are is like, I know this is something else and I'm going to send you to someone who might be able to deal with that a little bit better.
I love that.
Yeah. See how we're collaborating right here?
We are.
I love it. I am fascinated that you were sitting there in that seat on the Hers podcast, because we don't get to spend like really good face-to-face time like this. We're always like in DMs or in texts or maybe at a conference that we get to see each other. So thank you for coming to share your education. You're brilliant. You really are.
Oh my gosh, you're brilliant. And thank you for having me. I'm really glad we did this. It's so nice to talk.
Isn't it? Just to sit and talk, and like no interruptions. And I really am grateful that you are sharing information that the way you share it, because I think that what you were saying, that you were at the hairdresser and it was while washing hair that you had to bust that myth right then and there, that has now facilitated how millions of followers that you have. So thank you for all that you do. And thank you for sharing with me today.
Oh, thanks for everything you do too. You're amazing.
Thank you.